Hey guys, welcome back to Arizona Small Business Insider, the channel where we support and promote everything small business. So if that's something you like, if you like small business, if you like hearing their stories, how they got started, please make sure you subscribe to the channel, like this video, share this video. Any of that really does help the channel grow, you guys, and in turn helps me put these small businesses in front of as many eyes as possible. I'm really excited to be bringing you episode 12. I got to sit down with Scott Gulledge of Health Markets Insurance Agency. We did sit down virtually due to everything that's going on. To have you meet Scott, he's going to talk about how his brokerage got started, but more importantly, if you or someone you know has recently got laid off, Scott has some great solutions for those out there looking for health coverage and how to navigate the COBRA process. So without further ado, I'm going to have you meet Scott. Hey guys, I'm here with Scott Gulledge. Scott Gulledge is a licensed insurance broker with Health Markets Insurance Agency. Scott, welcome to the Arizona Small Business Insider.
Thank you very much, Chip. Appreciate it.
Yeah, you're welcome. I'm really looking forward to having you on the channel. And guys, Scott is going to talk to us about how he got started in the insurance business. Then he's also going to provide some solutions to anybody going through a tough time right now. So maybe some best plans you can hop on if you got laid off, or what exactly COBRA is and how you might be able to take advantage of that. Does that sound pretty correct, Scott?
Absolutely.
Awesome. So Scott, just tell the viewers how and when you got involved in health insurance and how you started your business.
Yeah, so I've been involved in insurance now for a few years. I've actually been involved in the realm of insurance for probably the last 10 or 12 years. I had friends back then who were like, hey, you should really get into insurance. You should really, go into this process. It was more on the auto and home side, and it wasn't something I really wanted to pursue and help with in that approach of helping people, because there's a property and casualty auto insurance agent pretty much on every corner. And so I just didn't really feel that's where I wanted to be. And then about 4 years ago, I had the opportunity to start really evaluating if I wanted to be in the insurance business. Actually, a little bit longer than that. I had a friend who was involved in Medicare. Okay. He tried to get me to do that. All the different times, it was always start with your friends and family and go through this phone book and kind of build your business that way. And that wasn't the style of the business that I wanted to create for myself and for my clients. I wanted to be able to have my friends and family want to come to me when they needed my help, not because I was trying to pursue a sale or trying to get that initial ball rolling. But it did allow me to kind of transition into that. So I've been doing this now a little over 2 years officially, but like I said, I've been in and out of the market with it off and on the last decade and a half or so, just through friends and contacts and people. But what I do is specifically dealing with health, Medicare, small business, supplemental, life insurance, and helping go through that.
That's great. So Scott, with your experience on the small business side, I know you're aware of what's going on out there today, tough times. So for some small businesses that maybe have had to lay off employees, can you explain to the viewers what COBRA is?
So COBRA is very simply put, it's the insurance that you've had when you were with your employer. Most people want to complain that COBRA is super expensive, or that it's ridiculous, or it's difficult in any aspect of that. But basically, COBRA is your insurance that your employer had, that you get to pay full price. So when you look at that aspect of that and look at the market, there's the Affordable Care Act, Obamacare, Trump Care. It's got probably half a dozen different names to it. But within that realm, you're allowed to be able to take advantage of what your current plan was. If you had a PPO before, you get to maintain that. Same doctor, same hospital, same deductible, all that kind of stuff. You're just now paying what the employer actually paid for you. So even though it may be expensive, if you were a family of 4 and you're paying $300 to $500 a month on a plan, and now all of a sudden your COBRA bill is $1,500 to $2,000, well, that's how much the company, in essence, did care about you. That's how much they were trying to support you and help you have what you needed to have. So with what I can do for that is take that $1,500 bill. We can look at the Affordable Care Act. We can look at private insurances, and we can say, okay, well, I had the budget of $500 to $600 a month. We can still hopefully work within that realm. In most cases, it fits most people's schedules and budgets. We look at the Affordable Care Act. We look at, like I said, the private insurances. So there is a transition. If COBRA really does fit your budget and needs, and it's not too expensive, then go ahead and maintain it and keep it for the next 18 months.
And then Scott, a best plan for someone. Let's say I'm a single individual and just lost my job, and I'm deciding between COBRA and maybe going through you directly. I guess that would be an option, right?
Absolutely. So you as the consumer can go through and go online and find the exact same plans that I can find for you. The advantage that you get through a broker is this is what I do every single day, whereas your expertise, Chip, is in a real estate world. You know the housing market, you know what's good, what's bad, what's the right house. If I gave you my list of criteria of what I want in my house, then you're going to be able to find the right plan for me. So you don't pay anything extra for me. What I do is go through and fine tune that to fit your budget, your scale. And we talk about the perfect plan is different for you than a family of four, than someone who's low 20s to someone who's in their mid 50s. And like I said, it's all about the budget. And we talk about high deductible, low deductible. Think of an analogy that I use for a lot of people is think of a smiley face, two eyes and a nose, without the smile mouth of it. But there's three types of ways to look at your insurance needs. How much are you actually using your insurance? The first circle being that health circle. That's your doctors, that's your deductible, that's your copay, that's all those different things. As good as those things are, sometimes those are also the negatives. Your doctors, your network, your copay, your deductible. And if you're a healthy individual, why do you want to be paying a lot of money for something that's going to change in 6 months to a year or even a couple of years down the road? We can go through and figure out other options that fill in that goal. Values is, look at that small business question that you kind of asked early on. You have that person who's working for that employer. They've been there for years. Well, they're to the point now where they're maybe 63, 64, 65, 67. So, and it's a husband-wife combo. And, now he's available for Medicare, but she's a couple of years away from that. Mm-hmm. Well, I can help with that transition into Medicare. And then I can also help the spouse get into that transition of the under 65 market to get the right plan for them. So that's the other advantage of going through someone like me, is it allows you to have that flexibility of having someone that can work in both realms. A lot of agents are going to be Medicare specific or under 65, specific, or they do small business specific. Being able to find someone like me isn't hard or super impossible, but we're a lot less out there than you might think of.
Oh, great. So getting back to that small business question, let's say I am the small business owner and I've got 9 employees and I'm really trying to get through this tough time. Is there anything that you'd be able to do to work with me as the small business owner and the health plan I have offered?
A lot of times there's calling the actual carrier. So I can come in as the agent and you have that small business through your different carrier. We go through and fill out a form. It's a simple one-page document that says, hey, I allow Scott Gulledge to help represent my business with this carrier. Combined with that, and we calling the carrier, if you're thinking it's a temporary challenge or a temporary situation, then we're going to be able to potentially just reduce that premium maybe for a month or 2 or 3. If we need to break the business and do something else, we can do that. Maybe there's a whole different carrier that you didn't even realize that was available to you to get a different plan. And even though you've had this carrier in this company for a long time, we can transition you the very next month into someone else. So you have that flexibility too.
That's great. And Scott, in regards to the business owners and the people you can help, are you limited to just Arizona, or can you service outside the state of Arizona?
I can service quite outside of it. I'm actually going to change my background for half a second to just kind of give you a perspective on what I can do for you. But I'm licensed in all those dark blue states. I'm able to support, I'm able to help all the different areas from the East Coast to the West Coast. And I can get more licenses as needed. So if there's a specific reason or enough need and you have that family member living in Ohio, we can talk about that and get that going for it. As an agent, it's fairly affordable to just grab another license depending on the needs and the reasons. It's not something just to do it just because, but if there's a reason or a family or needs, then I'm happy to explore those options with people. But for the most part, like I said, I can kind of work from the northern region, from Idaho down to Arizona, and then Arizona to the East Coast. And if you kind of do your hand through just throughout the United States. I remember kind of what I can do for a lot of people.
That's great. So to the viewers out there, watching this video, if you're an individual going through a tough time, maybe just got laid off, unsure what to do with your health care, or if you're a small business owner, not just in Arizona, and looking for some assistance there, I encourage you to reach out to Scott, let him consult you and see how he can help your business get through these tough times.
Thank you so much, Chip.